Jay, I'm upstairs on AFU today. I just want to have a quick word about a lady that's on there with a hip fracture. Probably the right admission. She's quite sick. She's got acute kidney injury. Potassium was a bit high, so I'm pleased they put her on under our care rather than orthopaedic surgeons. But a bit worried about her pain relief because she's had, I think, 1 gram of paracetamol since she came in yesterday. She's been in for 36 hours now. Had some more paracetamol this morning on AFU, and I'm just not sure what was going on that people weren't a bit more aggressive with the pain relief. Any thoughts?
Yes, I mean that's a real shame that we didn't give her some decent pain relief. It sounds like she's really frail, so you only have paracetamol. Yeah. So is there a reason why we can't give a little bit of opiate?
Well, I'm not sure really. She was a bit agitated yesterday, fighting people off, which I suspect was down to the pain. And access was difficult. I don't know whether they tried to give her some opiates, but there's nothing recorded on the charts, but I suspect they probably tried. The ambulance crew gave us some, I forgot about that.
We could try some intranasal fentanyl. We use it in children all the time. I've certainly used it in agitated older people with hip fractures, and it's really good. So it might be worthwhile giving that a go.
Yeah, we've not used that upstairs before, so is that fairly straightforward?
Absolutely. I can bring some from the children's ED and actually come and do it for you upstairs, and you can see how it works and think about it as a pain modality for the future. Another thing which we can definitely do, and I'm hoping it was attempted yesterday, or it may not have been, but maybe once I calm her down with some intranasal fentanyl, I can actually put in a hip block, so I can bring the ultrasound machine from the resus room and just come and do a ultrasound guided femoral block, which will give a good pain relief.
So you'd use the intranasal fentanyl just to get the initial control in patients that are a bit tricky, can't get access, whatever, and then move to the
either IV.
And how long does the block last for?
So if I use a combination of some dignicaine and some bupivacaine, I think we can keep her reasonably comfortable for 4 to 6 hours.
Oh, fantastic!
And if she doesn't go for operative repair for some time, you could even get a clever anaesthetist to instill a little tube inside the femoral sheath and run an infusion of bupivacaine.
So we get the pain under control, get it more settled, optimise the clinical state, and then look at the definitive management.
Yes.
Great.